Hello, everyone. My name is Dr. Fofanova. I am the co-founder and CEO of Koda Health. And I'd like you to take a minute and think about your loved ones, maybe your parent or your spouse. Do you know what kind of care they would want if they were to fall seriously ill right now? Most people say that they do, but studies actually show that the likelihood of you choosing what they would have wanted is only about 50%. And that is personally devastating for families, but it's also egregiously expensive for health systems and payers that spend over $100 billion each year delivering care people don't even want. Now, traditionally, planning for future healthcare has fallen to estate planning attorneys and to those individuals proactive enough to pursue direct to consumer solutions. But these approaches tend to ignore the quality of the conversation. They cut doctors out of the process and frankly, they target people who can already afford it. But most Medicare beneficiaries can't. It is the oldest and the poorest that are the highest utilizers of healthcare, and they do not have access to this. So we knew that in order to move the needle, we needed to make this process easy, engaging, and accessible for everyone. So at Koda, we're digitizing this process from end to end using motivational interviewing and personalized content. We help patients navigate this discussion with their families and their providers. And as they do, their responses are seamlessly captured to generate the necessary legal and medical documents they need to protect their care. Documents they can access, share, and virtually notarize on our platform for free. Now, this is an annual discussion. It happens in the clinic proactively long before a crisis hits. So by digitizing this process, we are able to not only make it easier to introduce for physicians, but we also streamline the billing and documentation process associated with it, allowing staff resources to be allocated more efficiently. Because quite simply, when doctors use Coda, they make money too. So what do I mean by that? Well, long story short, this has always been a multi-billion-dollar problem, but the regulatory environment didn't exist to support a solution like this until now. With the silver tsunami aging in during a global health crisis, Medicare is feeling the pinch. So they're rolling out novel reimbursements and performance metrics aimed at dragging this conversation into the clinic. And as a B2B solution, Coda lessens the lift for physicians to cash in on this new line of reimbursement revenue. And for at-risk systems, we help them save on the order of $10,000 or more per patient while meeting these new metrics. So with Medicare encouraging everyone over the age of 65 to start planning, that's an annual revenue opportunity of over $6 billion. Now, to execute on this vision, our HIPAA-compliant beta is already live in fee-for-service clinics here in Houston. And our paid pilot with the Houston Methodist ACO is helping them navigate this conversation with their patients. And lastly, we've received investment from the world's largest payer organization through the Techstars United Healthcare Accelerator. And here we've kicked off the vendor approval process in prep for an enterprise level pilot. And I want to stress that these pilot locations are seeing real change because when you engage in quality conversations, the metrics that matter go up. Our pilots have seen a 35-fold increase in proactive planning with phenomenal completion rates and over 75% of patients sharing their care plans with their medical decision makers. And most importantly, our patients who have been meaning to get around to this but haven't due to time or resource constraints are grateful for being able to stay in control of their healthcare journey. Now, over these last few months, we've seen growing market traction from private practices, enterprises, and payers alike across the nation. We're ready for the next step in our journey. And Coda's team of doctors, scientists, and engineers were actually specifically recruited by the Texas Medical Center to address these critical needs in healthcare. And on a personal note, each of us have personally had hundreds of these conversations with the very patients we serve before we ever wrote a single line of code. Our efforts have attracted a star-studded advisory board of industry execs who recognize the cultural shift happening in this space. Now, everyone deserves to stay in control of their healthcare journey, and I truly hope that you will join us in this mission. Thank you.